Have you ever wondered how something as small as a cluster of cells can disrupt one of the most powerful organs in your body, the brain? Every year, thousands of people in India and across the world face this harsh reality. Brain tumors are more common than you might actually think, and their impact on life is profound. So today, let's unpack this topic in simple terms and understand what brain tumors are, what are the types of brain tumors, and how they are really treated. Trust me, this is a conversation worth having. Hello everyone, and welcome to the Star Health Insurance YouTube channel. And in this video, we will be talking about brain tumors. I'm Dr. Shylesh MP, a consultant neurosurgeon. Brain tumors are a significant health issue worldwide. With the growing recognition of their complexity and the impact on the quality of life, brain tumors have become a hot topic today. Approximately 250,000 cases of primary brain tumors get detected worldwide each year. Approximately 22,000 to 25,000 new cases of brain tumors are diagnosed annually in India alone. The survival rate for a brain tumor patient is variable depending on the tumor type and the grade. For aggressive tumors like a glioblastoma, the survival rate is poor, with the median survival time just being 1 year to 18 months. So today we'll be talking about what a brain tumor is, what are its types, what are the grades, what are the causes and risk factors for one to develop a brain tumor, how to diagnose a brain tumor, and how to treat it. And also we'll be discussing about how to live with a brain tumor. So let's begin. What is a brain tumor? A brain tumor is an abnormal growth of cells within the brain or its surroundings. Tumors can arise de novo within the brain, which we refer to as the primary tumors. And the secondary brain tumors, of course, are the ones which develop outside the brain and spread to the brain itself. Brain tumors can also be classified as benign or malignant tumors. Benign tumors are kind, non-cancerous, slow-growing and less infiltrative tumors when compared to malignant tumors, which are more cancerous and aggressive. Though we call it benign, even a benign tumor can cause significant problem if they grow to a large size. They exert pressure on the surrounding brain. So let's discuss about the symptoms of brain tumor. Symptoms of brain tumor depend on its size, location, rate of growth. What are the common symptoms one faces when he or she is harboring a brain tumor? Headaches, of course, are the most common symptom. These headaches are worse during the mornings, aggravate on coughing. They may be associated with nausea, a sensation of vomiting, or repeated episodes of the so-called projectile vomiting. Seizures are another common complaint. New-onset seizure in an adult is an important thing to be noted because a person who has never had seizure in his past, once he develops a seizure sometime middle of his life, then it should be a concern, a warning sign for a existing brain tumor. Nausea and vomiting, of course, especially in early mornings, could be a sign of raised intracranial pressure or pressure within the brain, which could be commonly due to a brain tumor. He or she may develop vision problems such as blurring of vision, seeing objects double or called as diplopia or double vision, or there may be complete loss of vision or vision loss in one part of the area of the visual field, which we call it as the field defects. He or she may experience memory deficits, cognitive changes, difficulty to remember things and concentrating. His or her personality may change, may become irritable or depressed with frequent mood swings. He or she may develop a weakness or numbness or a specific portion of the body, such as the arms, legs, face, etc. Balance and coordination problems are another set where the tumors arise in the small brain or the cerebellum or the brainstem, which is in the lower part of the brain, which connects the body to the rest of the brain. When it is affected, he or she may develop balance or coordination issues. Speech difficulties happen when the tumor is in the speech area of the brain. Slurring of speech, naming difficulty, trouble in finding words, and understanding words becomes difficult when the tumor is sitting over your speech area, which is more commonly on the left side of the brain. If you notice any of these symptoms, it is important that you consult your doctor as soon as possible. So what are the various types of brain tumors? Brain tumors are classified into several types, which are often named based on the cells which they originate from. Brain tumors are graded based on how abnormal the cells look under a microscope and how quickly they are likely to grow. The grading scale is from grade 1 to grade 4. Grade 1 tumors are least aggressive and grade 4 tumors are malignant and most aggressive. The higher the grade, the more the aggressive nature of the tumor is. The most common types of tumor that we encounter are gliomas. These are the most common primary brain tumors. Meningiomas. These are the most common benign tumor occurring within the brain. But the most common overall brain tumor is a metastatic tumor. So what exactly is a metastasis? When there is a cancer elsewhere in the body, such as the lung, breast, thyroid, or a kidney cancer, it can spread into the brain. These are called as metastatic brain tumors. These are the most common tumors that occur in the brain overall, and they are the most common secondary tumors as well. Apart from this, the other common tumors are pituitary tumors. In children, there are some tumors known as the medulloblastomas, which occur in the small brain or the cerebellum. These are very common in children. Schwannomas are other kind of benign tumors that arise from the nerve sheath. These most commonly occur or arise within the nerves which cater for the hearing. These are called as the vestibular nerves, hence the name of the schwannoma is a vestibular schwannoma. So these are the common types of tumors that we come across in our practice regularly. So let's dive into the causes and risk factors for brain tumor. The exact cause of a brain tumor is not always clear, but certain factors may increase the risk of one to develop a brain tumor. More commonly, genetic conditions such as neurofibromatosis, Lie-Fraumeni syndrome are associated with development of brain tumors and other types of cancer as well. Radiation exposure, especially in childhood or younger adulthood, may predispose you to develop a brain tumor in future. Family history of brain tumors are also important because most brain tumors are not inherited. Certain set of tumors can arise or can run in families. Age is another common factor. Though brain tumors can occur commonly in children as well, but the chances of one to develop a brain tumor increases as we grow old. Gender also plays a certain role in development of brain tumors. Certain kinds of brain tumor are more common in women, for example, meningiomas. So let's understand how a diagnosis of brain tumor is made. If a brain tumor is suspected, a doctor will typically recommend several tests to confirm the diagnosis and to assess the tumor size and location. MRI is one of the best tests. It is a non-invasive imaging technique without radiation. It provides the best detailed information about how a brain tumor looks like, how big it is, what are the critical structures surrounding, what is the blood supply, what is the important brain structures around it. A CT scan sometimes used as a preliminary test in emergency cases. If MRI is unavailable, we use CT scan. So a biopsy is a small sample of tissue which may be removed from the tumor to determine what type of tumor it is and grade and treat them accordingly. It is sometimes done before a surgery through a small needle which goes in through the skull, and a small chunk of tissue is delivered out and subjected to histopathological examination. Sometimes a doctor may say you have to undergo a PET CT or a PET scan. What exactly is a PET scan? It detects any cancerous tissue in the body. So in case of the so-called metastatic tumors, we get to know where exactly the tumor is arising from. That is the role of a PET scan. So what are the various treatment options for a brain tumor? It depends on the tumor type, size, its location, and the grade, as well as the patient's overall health. The common treatment modalities include the first line, surgery. We aim to remove as much as tumor as possible in order to remove the tumor burden and its compression over the normal brain. However, not all tumors are operable. So the next line of treatment or the adjuvant modalities of treatment are chemoradiotherapy, where in radiotherapy we use high energy to kill the tumor cells. These are powerful X-rays which hit the cells which are rapidly dividing and cause tumor cell death. The other modality is chemotherapy, where we give powerful medicines to kill or selectively kill only the tumor cells. There are other modalities like targeted therapies, where specific genetic mutations or proteins involved in the growth of the cancer cells are targeted. This approach can be used for certain types of tumors only. Immunotherapy is another modality where the body's immune system is stimulated to recognize and kill the tumor cells alone. So once you have been treated for a brain tumor, recovery and rehabilitation becomes the next step, the most important step. It can take time, however, and some people may require a long-term rehabilitation in the form of physical therapy, occupational therapy, speech therapy, etc. So once you have been treated for a brain tumor, everyone wants to know how long he is going to make it, how long he is going to live without any complications. So what is the overall prognosis of a brain tumor? It depends on various factors such as the tumor type, the grade of the tumor, the location of the tumor, and how well the tumor has responded to the treatment, how much of the tumor is removed by the surgery, and how well it has responded to the radiochemotherapy. Some tumors are slow growing and curable, while the others are more aggressive. They may recur. They may not be curable. Your doctor will provide specific information about your diagnosis, treatment options, and potential outcomes before starting the treatment itself. So, in India, there are various challenges in treating a person with brain tumor. The first important thing is they come late because of a late diagnosis. Time is of critical essence in diagnosing a brain tumor. When a tumor is diagnosed at a later stage because of delayed medical consultation or limited access to advanced diagnostic imaging, or the non-specific nature of early symptoms, they come late. So the treatment is initiated late, we may have more complication. Public awareness about brain tumors is relatively low. Many people in the rural areas may not even be aware of brain tumors as a condition and may attribute their symptoms such as headache, nausea, vomiting to other causes such as stress or fatigue. So another challenge in India is that there is a stark disparity in access to modern treatments like radiotherapy and chemotherapy in urban versus rural areas. Major cities like Delhi, Mumbai, Bengaluru have access to high quality healthcare facilities. In rural areas, often we face challenges in terms of both diagnosis and treatment. The other important thing is the cost of the treatment. Brain tumor treatment, especially for advanced or aggressive type of tumors such as a glioblastoma, can be financially burdensome. Improving the brain tumor scenario in India is also another challenge. Several initiatives could help improve outcomes for brain tumor patients in India, like public education campaigns to raise awareness of symptoms of brain tumors and the importance of early diagnosis have to be emphasized. Strengthening healthcare infrastructure, expanding access to high-quality diagnostic facilities such as MRIs and CT scan, and advanced treatment options such as microsurgery, chemotherapy, and radiotherapy in rural areas and underserved areas. So setting up a support network group for patients who have been treated for brain tumors provides emotional, financial, and logistical assistance to patients as well as the caregivers. So, to conclude, living with a brain tumor involves facing numerous physical, emotional, and practical challenges. But many patients are able to live fulfilling lives with the right support, treatment, and coping strategies. It's important to work closely with your healthcare team, seek emotional support, and continue to live life as fully as possible. With advances in brain tumor research, many treatments are improving and patients are finding ways to adapt to their new reality. Above all, it is essential to be kind to yourself and stay hopeful for the future. So that's all for the video. If you like this video, hit the like button, share it with your friends, and do not forget to subscribe to Star Health Insurance YouTube channel. Thank you.